Hello friends, I am Dr. Sandipaa. Welcome to my channel Homeopath. In my channel I will be discussing how the totality, how the homeopathic practice practically can be done. So in this series I have done so many videos. If you are new to this channel, please like, share and subscribe our channel. And if you have any doubts, please put in the comment section so that I can do videos on those subjects also. So today's subject is how to begin homeopathic practice and what are the levels of homeopathic practice and how we come to know that homeopathic treatment is over or completion of homeopathic treatment. So first of all, how to start homeopathic treatment? As our masters, Dr. Hahnemann, Kent and so many masters has advised us to understand the total modus operandi of disease. So that is to say, what is the cause of the disease, what is the triggering factors of the disease, how the patient behaves mentally, physically, environmentally to a stimulus, and taking note of all these things together and putting together, we come to a total individualistic remedial diagnosis. So that is to say, when we start to take a case, you must be having few qualities, as Dr. Hahnemann tells us. That is unprejudiced observer. That is to say, you must not have preconceived idea the patient is giving few symptoms, and you must not perceive any of the symptoms by yourself and make the totality. That is the problem in a beginning homeopathic practice. So beginning homeopathic practitioners and a student, what they will assume is the patient will come and give a totality like this. No, it is not possible also practically. So what is that is, you must understand how the disease has started. Let it be acute or let it be chronic. So cause of the disease is the main focus of every homeopathic physician. So without cause, the effects are not there. So cause and effect are always associated. So in this course, what we will do is, we will go to the depth of the understanding of the patient. So if it is an acute case, it is very easy to diagnose, easy to treat, easy to come to a totality. Only one thing which is confusing in acute is, so you will be confused to give bryonia, to give aconite, to give arsenic, to give pulsatilla, simply because it's not because of the patient's problem, it's because of your unclarity of the medicines. So if you are clear in the medicinal picture, acutes are the very good cases where we can miraculously cure the patient just in 24 to 48 hours. Let it be an admitted patient or a walk-in patient. So if you keenly observe the patient, you can come to a proper remedial diagnosis. So in this course, one example I want to tell you, that is arsenic has thirst, pulsatilla has thirst, bryonia also has thirst. So all these remedies has a different thirst. So arsenic is more restless in his mind, body and his activities. Pulsatilla is more introverted and his mucous membranes are dry, but he is not at all interested in drinking water. And bryonia is also a complement to pulsatilla. So wherein bryonia has marked heaviness, marked aggravation by motion, any movement aggravates, and bryonia is a hot patient, pulsatilla is a hot patient, but arsenic is very cold, chilly. And one more medicine which is confusing in this group is Naxomica. So Naxomica, if he comes, he will be very irritated, he will be very irritable. At the same time, he is very chilly. Chills are very dominant in pulsatilla, Naxomica and bryonia, even in arsenic. So how to differentiate this? That is the biggest challenge of every homeopathic physician. So if you have a totality of a picture of each individual acute case, you can pinpoint and give a correct indicated medicine so that he will improve in just 24 hours. If you give a medicine now, another 20 minutes or 30 minutes, he must pass urine and he must get the amelioration in his main symptoms, that is headache, fever, cold, cough, movement aggravation, so many things he will be telling. So if you indicate a proper indicated medicine, he will get an improvement in half an hour to 45 minutes. If it is not improving, the medicine is wrong. Sometimes partial improvement is also noted, wherein the follow-well medicine is given by the doctor. So you must give a proper indicated single medicine. So this is about acute one. In chronic, we must go in depth and understand the cases so that what is the root cause of this symptomatology or the disease. One example I want to let you know, friends. So one patient had a chronic constipation with abdomen pain. So totality was showing arsenic, totality was showing so many medicines, but it was not at all relieving the patients. So I could not gauge what exactly the modus operandi was, and I could not gauge why this trigger is happening in the patient. So when I observed the patient properly and asked the relatives of the patient, so there was a daily quarrel in the home between the maid and the owner of the house. So that was the triggering factor of abdominal pain and constipation. So anger as a cause, you come to only few medicines, that is Naxomica, Chamomilla and few more medicines. But Naxomica and Chamomilla are very close to this patient. So I gave Naxomica so that the patient improved immediately. So this is the important thing what a homeopathic physician should observe or take note of. The triggering factor, the cause was daily scolding, and that suppressed emotion or the anger, vexation was causing the abdomen pain in the patient. So this is the way we must go through the case in its minute details and understand the case. So in next video, what I will be talking is levels of diseases. So in levels of diseases, we will be discussing in detail how the levels of diseases to be taken into consideration and what is the homeopathic response when you give an indicated medicine for each individual patient. This is all today, friends. Thank you and take care.